My name is Dr. Carol Marquez, and I'm a clinical professor of radiation therapy at Stanford University. I've been treating cancer patients with radiation for over 27 years, and in that time I've treated hundreds of breast cancer patients. The treatment techniques have improved significantly in that time, but we still see lasting side effects from the radiation in the normal tissues in the area that we treat. One of the most common side effects I've seen in my breast cancer patients is tightness of the arm and limitation in the range of motion in the chest and shoulder, sometimes accompanied by pain or discomfort. This tightness can develop months after the surgery and the radiation are complete. It can happen after any type of surgery, whether the entire breast is removed or just the tumor is removed, and after any type of reconstruction when that is done. This tightness is different than lymphedema, which is swelling of the arm or breast. Lymphedema happens when there is disruption of the normal lymphatic flow, either because the lymph nodes have been removed, as in surgery when there's an axillary dissection, or the lymph nodes have been scarred by radiation therapy. This tightness of the arm and chest is sometimes referred to as radiation fibrosis syndrome. It is caused by the scarring of the fascia that covers the muscles in the areas that we treat. These muscles include the pectoralis major and minor and the serratus anterior. This syndrome has been poorly studied, but it is clear that movement helps to decrease the stiffness and the tightness and can help to improve the pain that people experience. The purpose of this video is to give you information about the types of movement that can help relieve this scarring and help improve your range of motion and your discomfort. To tell you more about the importance of movement as it relates to fascia and injury, we have enlisted the help of a yoga instructor with specialized training in this area. Her name is Kirsten Jacobson, and she is an experienced registered yoga teacher with more than 1,500 hours of training in yoga, movement, and anatomy, including 300-hour teacher training sessions. She is also certified in Tom Myers Anatomy Trains, Modules 1 and 2, with an emphasis on myofascial anatomy and functional movement. She is also a functional range conditioning mobility specialist and a mat Pilates instructor, and she holds a PhD from Stanford University in film theory, history, and criticism. My hope is that this tool will help you to improve your range of motion and decrease the pain and soreness we can sometimes see. In the next segment of the video, Kirsten will teach you about fascia and its unique properties and the scarring that we see. She will then go through a series of movements or positions that you can use to help improve your range of motion and decrease the tightness in the arm, chest, and shoulder, and improve the soreness that you experience. My hope is that you find this tool helpful and informative. Here's to your continued good health.
Hey everybody, my name is Kirsten, and I am first and foremost a yogi. I've been practicing yoga for over 20 years, and I've been teaching yoga and Pilates and functional movement for approximately 6 years. I come to yoga through a series of injuries, including a broken back and a blown out disc, both of which have taught me to move slowly, patiently, mindfully, and with a bit more intelligence. I am here today with Dr. Carol Marquez to share with you the knowledge and experience that countless teachers have shared with us, whether they be doctors of Eastern and Western medicine, anatomists, physiologists, or fellow yogis. If you're watching this video, you have a unique and unparalleled understanding of your own anatomy and what movements, whether they be large or small, feel great or not so great in your body. A profound awareness, deep understanding are the silver linings of experiences we don't always ask for, but we use these heretofore unwanted assets to improve our health, our well-being, and to help those around us. So why don't we begin with a big question? What is the largest organ in the body? Some might say fascia. In early 2018, thanks to advances in electron microscopy and a number of changes in the way tissues are prepared for inspection under the microscope, scientists were able to peer upon tissue samples unencumbered for the first time. In other words, rather than pressing the tissue samples between two planes in order to fix them in place, they simply allowed the tissue samples to exist as they do in real life. And what they discovered was not a dense mass of collagen and protein that they typically thought they were looking at under the microscope, but rather a sophisticated network of multi-layered tubes and conduits that enabled the flow of fluid from one side of the sample to the other. Imagine a glass pan of springy semi-al dente bucatini pasta, the type of pasta that's shaped like little tubes. Imagine now looking at that pasta from the side. What you would see would be a multi-layered structure enclosed in that glass pan. Now imagine taking another pan and pressing that pan so hard atop that pasta that all the olive oil spills out from the tubes collapse, and the pasta becomes one giant clump of carbohydrates. I'd still eat it, but it wouldn't be the same. Essentially what the scientists were missing was not the dense collagen protein, the samples themselves, but rather this very sophisticated network of multi-layered tissue enabling the flow of fluid from one side of the pan, one could say, to the other. What we can think about is that the pan itself is fascia, the noodles are fascia, and the oil is lymph. So what is fascia? If you eat meat, no judgment, you have likely deboned a chicken. And if you've deboned a chicken, you've likely come across a thin layer of, what is this stuff? It looks like a spider web and completely inedible. I think I should throw it away. That thin layer of gossamer-like material is fascia. Fascia is comprised of collagen, elastin, reticulin, ground substance, and it is essentially throughout the entire body. It is ubiquitous. It is right underneath the surface of the skin. It envelops muscles, groups of muscles. It envelops bones. It's the periosteum, for example. It's the bones themselves. In some areas, the fascia is so thin that it cannot be seen without visual aid. And in other areas, the fascia is so thick that it forms a very stable structure throughout the body, from, for example, the xiphoid process to the pubic symphysis. So there is this line that runs vertically along the front of the body, which is called the linea alba. Typically, we don't think about fascia when we think about anatomy. We only focus on muscles and bones, the things that we typically can see. But chances are you actually have seen fascia in a living body. When women are pregnant, oftentimes a dark line appears vertically along the abdomen, and that dark line is fascia that has essentially been darkened by an increased production of melanin in the body. So this is a line of fascia that you can see in a living body. Historically, when we think about anatomy, we think about it in parts: bones, muscles, tendons, ligaments. But that's actually changing. We're now looking at the body in a more holistic fashion. So rather than cutting through the fascia and getting to the meat per se, we actually are beginning to look at fascia and how it functions in the body and how it gives us our shape. If you think about it, no bones in the body actually touch, or they should touch. So if I take a look at this model, it's called a tensegrity model. It is essentially a model of how the body works. So these wooden struts would be the bones, and the black rubber bands would be lines of tension or fascia, what we call myofascial meridians. So if I pull one of these rubber bands, the whole model is going to move. If I compress, the model will compress, and if I release, it will rebound. So this is a model of tensegrity, and it is essentially how the body functions. So if I pull at one side of my shirt, my whole shirt is going to stretch. So all of the fibers will chase the direction of pull. The same is for the body. If I impact one part of the body, the whole body will be impacted as a whole. Typically, if we work out, we might say, I'm going to work chest and biceps today and back and triceps tomorrow, but that's not necessarily how things work. Any part of the body you move, the rest of the body will respond. In short, fascia is everywhere. It doesn't simply help us move, it is the organ of movement. Not surprisingly, fascia is not only a record of our movement, but it's also a record of our immobility. When I was in high school, a friend of mine worked at an ice cream shop. The winter months weren't very busy, obviously, but in the summertime, she scooped ice cream for hours and hours on end, and by the end of the summer, her right arm was considerably larger than her left. So yes, she built up muscle mass, but due to repetitive movement, she also built up a stronger line of fascia throughout her arm, and what is called the functional line, which runs from one shoulder to the opposite hip. So it forms the shape of an X on the front of the body and the back of the body. So if one were to peer under her skin, one would obviously see the muscles on one side being larger than the other, but one could also see a thickening of fascia that's more substantive on one side than it is the other. So maybe she should have alternated between right and left. Sorry, Tara. While fascia is a record of movement, it's also a record of our immobility. If I break my collarbone, for example, and am put in a sling for a number of weeks, my arm will not only atrophy, but when the sling is finally removed, I will experience some difficulty moving my arm again. The reason for that difficulty of moving the arm is due to an increased thickening of fascia and a number of adhesions that form when I'm not moving. We assume the shapes we put our bodies in most frequently, which is why your mom was likely right when she said if you keep making faces like that, your face is going to stay that way. Does this mean we are destined to be an Italian dish forever? The answer is no, thanks to movement and the 4 fundamental properties of fascia that movement itself enhances and facilitates. What are the 4 fundamental properties of fascia? They are elasticity, plasticity, viscoelasticity, and remodeling. Elasticity is essentially fascia's ability to undergo deformation, so you stretch, and reformation, you let go, and the body bounces back. So if I have a rubber band and I pull the rubber band and I let go, if the rubber band bounces back, that's its elasticity. Plasticity is actually the band's ability to lengthen, but if I let it go and it doesn't rebound, it simply is plastic, it's not elastic. So quick note on elasticity and plasticity. When we train the body and we go through movement, what we want are equal parts elasticity and plasticity. We don't want to have too much of one or too much of the other. So let's say I have a hair tie and I want to put my hair back. I buy the rubber band, and when I first get it, it's really stiff, and most of us have done this. We take the rubber band, we kind of stretch it a little bit and try to tailor it to the perfect sense of elasticity. But by the time we've made it just perfect, then it starts to lose its rebound and it becomes just a useless loop. What I want is a rubber band that I can use forever. What I want is a body that I can use forever that will respond to whatever demands I ask of it. So if I pull the rubber band and I let go and it rebounds, that's exactly what I want. Another property of fascia is viscoelasticity. In a few words, viscoelasticity is nonlinear, time-dependent deformation. So this property is a little bit trickier to describe, so what I'm going to use is a prop. This is thinking putty. If I warm up the thinking putty and I open and stretch it slow, it will follow suit. If I put the putty back together and then I try to go quick, the putty will simply break in half. So this is viscoelasticity, and it's also something that is existent in fascia itself. So with viscoelasticity, you can also imagine shocks in a car. If you go over a couple of bumps pretty slow, the car will kind of bounce. And if you drive over a couple of speed bumps really quick, the shocks will absorb that energy. The same goes for the body. If I jump off a chair, for example, I'm not simply going to crush on impact. I might compress a little bit, but I'm simply going to rebound. Another property of fascia is reformation. So it's essentially the body's ability to bounce back. It's not unlike viscoelasticity. So again, if I jump off a high chair, for example, I'm not simply going to crumble on impact. I'm going to rebound. And the same goes for how I put my body under various stresses. So let's say I stand on one foot for 4 years. My body will lay down fascia along a line of tension and gravitational pull. So one thing to consider regarding fascia is its half-life. Muscles, for example, let's say you do a workout, you might experience DOMS, which is delayed onset muscle soreness. So if you've done a bunch of sit-ups or some push-ups, you might feel sore for a couple of days. But within a matter of days, 3-4 days, that soreness begins to disappear. So this is your body's response to the stressors you've put it under and its ability to reform and repair under a short period of time. Regarding connective tissue and fascia, for example, the half-life is six months to approximately 2 years. So the half-life of fascia obviously is quite a bit longer. So if you've experienced some damage to the soft connective tissues, the repair time is going to be quite a bit longer. So make sure that you're patient with yourself and give yourself some time to heal. The treatments you have undergone have impacted your entire body. So as I mentioned before, fascia is a single unit. If you can imagine, it's almost like a personal bodysuit, and only the knife makes it plural. With all of these life-saving interventions comes inflammation, and with inflammation comes adhesions. The body will send collagen, reticulin, elastin to the sites of injury, and when that happens, those areas will thicken, and with that adhesions, with that inflammation, fascia begins to stick to more or less everything. Blood vessels, lymphatic vessels, viscera, your internal organs, you name it. So essentially, what happens is we feel a decreased range of motion, decreased range of movement. We have a difficult time essentially doing everyday tasks, and we might experience a sense of pain. Some people have, or some researchers have investigated how much pressure fascia can produce in 1 square inch, and in some cases they've tested up to 2,000 pounds. So this is actually not something that we can see on typical medical exams. It's something that you simply feel internally. Here I can't help but return to the pasta again. So if I cook the pasta, we put it in the refrigerator and take it out for later, obviously all of the oil is going to be at the bottom of the pan or around the sides of the pan. So it's not unlike when we took the pan, another pan, and pressed it on top of that pasta and compressed everything down so that all of the tubes collapse and all of the oil leaks out the sides. So the same happens in the body. When you have increased inflammation and a thickening of the fascia, it's almost as though we've pressed the pan down on top of that layer of pasta and everything has been more or less compressed. And if everything is compressed, we no longer have the flow, the natural flow of oil, or in this case, lymph, going from one part of the body to another. So typically what happens in this case is not only by way of compression and the thickening of fascia and the development of scar tissue, but also just by way of less movement, we might experience, or patients might experience, lymphedema. So typically what happens then is that the flow of lymph, or what we were imagining as oil in the pan of pasta, no longer flows through open channels or open circuits. Everything has been compressed, and the flow of fluid from one part of the body to the other is encumbered. So in some cases, the result is AWS, or what is known as axillary web syndrome, also known as cording. With this cording syndrome, what happens is the body essentially loses its ability to move fluid from one part of the body to the other. So we typically see this in the arm or the limbs. And the only way to work against this cording or even lymphedema in some more extreme cases is to take compressive type materials around the limb to essentially encourage fluid to flow back to the rest of the body. So again, I know I'm using the pasta example a lot, but hopefully it's helpful. If everything is compressed and under so much pressure, if all of those little bucatini pasta, if all of those little conduits have essentially been pressed and there's a lot of scar tissue, you'll have less movement, not only movement as we know it, bending and straightening in the arm, for example, but subtle internal movement, meaning flow of lymph from one part of the body to the other. Over the course of this discussion, I've mentioned a number of lines of tension throughout the body. These lines of tension are called myofascial meridians. The body possesses several of these lines, but for the purposes of this video, we're only going to look at 4. So the lines are named as follows. There's the arm line, the functional line, the spiral line, and the lateral line. The movements that we will look at will focus primarily on those lines, but again, as I mentioned before, if you move one part of the body, the rest of the body is going to follow. But essentially what we're going to try to do is focus primarily on the areas that are greatest impacted by the treatments you've undergone.